Diabetes is a condition that affects people of all ages. There are several forms of diabetes, but type 2 diabetes is the most common. A combination of treatment strategies can help manage this condition for an individual to live a healthy life and also prevent complications. In this video, we'll look at the symptoms and causes of diabetes. We'll also look at the diagnosis and test of diabetes and also management and treatment of this condition. What exactly is diabetes? Diabetes is simply a condition that happens when your blood sugar level, that is glucose, is too high. It develops when your pancreas does not make enough insulin, or when it doesn't produce any insulin at all, or when the body is not responding to the effect of insulin properly. Diabetes affects people of all ages. Most forms of diabetes are chronic and all forms are manageable with medication or with a change in lifestyle. Glucose majorly comes from carbohydrates in our food and drinks. It serves as a source of energy for the body. Our blood carries glucose to all body cells to use for energy. When glucose is in our bloodstream, it needs help, a key, to reach its final destination. The key is insulin, which is a hormone. If our pancreas is not making enough insulin, or our body is not using it properly, glucose will then build up in our bloodstream, causing high blood sugar level, which is known as hyperglycemia. Over time, having consistently high blood glucose level can cause health problems such as heart diseases, nerve damages, and eye issues. The medical name for diabetes is Diabetes Mellitus. Although there's another form of diabetes known as Diabetes insipidus, which is very different from Diabetes mellitus. Both Diabetes mellitus and Diabetes insipidus share the same name, diabetes, because both of them cause increased thirst and frequent urination. Diabetes insipidus is not as common as Diabetes mellitus. What are the different types of diabetes? There are several types of diabetes. The most common form include type 2 diabetes, type 1 diabetes, gestational diabetes, and pre-diabetes. Type 2 diabetes is the type of diabetes in which the body does not make enough insulin, or the body cells does not respond normally to insulin, that is insulin resistance. This is the most common type of diabetes. It mainly affects adults, but children can have it as well. Type 1 diabetes is a type of diabetes in an autoimmune disease in which the body immune system attacks and destroys insulin-producing cells, that is in the pancreas. The reason for this is unknown. Up to 10% of people who have diabetes have type 1 diabetes. It is usually diagnosed in children as well in young adults, but it can develop in any age. Gestational diabetes is a type of diabetes that is seen in pregnancy. Gestational diabetes usually goes away after pregnancy. However, if a woman has gestational diabetes, she is at a higher risk of developing type 2 diabetes later in life. As for pre-diabetes, this is the stage before type 2 diabetes. The blood glucose levels are higher than normal, but not high enough to be officially diagnosed with type 2 diabetes. Other types of diabetes include type 3C diabetes, latent autoimmune diabetes in adults, maturity onset diabetes of the young, neonatal diabetes, and brittle diabetes. Type 3C diabetes is the form of diabetes that happens when the pancreas experiences damage other than autoimmune damage, which then affects the ability of the pancreas to produce insulin. Conditions like pancreatitis, pancreatic cancer, cystic fibrosis, and hemochromatosis can all lead to the damage of pancreas and therefore result to diabetes. As for latent autoimmune diabetes in adults, that is LADA, it is just like the type 1 diabetes that results from autoimmune reaction, but it develops much more slowly than type 1 diabetes. People diagnosed with LADA are usually over the age of 30. Maturity onset diabetes of the young, that is MODY, is also called monogenic diabetes, which happens due to an inherited genetic mutation that affects how the body makes and also uses the insulin. There are currently over 10 different types of MODY. It affects up to 5% of people with diabetes and commonly runs in families. Neonatal diabetes is a rare form of diabetes that occurs within the first 6 months of life. It is also a form of monogenic diabetes. About 50% of babies with neonatal diabetes have the lifelong form called permanent neonatal diabetes mellitus. For the other half, the condition disappears within few months from onset, but it can come back later in life. This is called transient neonatal diabetes mellitus. Lastly, the brittle diabetes. The brittle diabetes is a form of type 1 diabetes that's marked by frequent and severe episodes of high and low blood sugar levels. This instability often leads to hospitalization. In rare cases, a pancreas transplant may be necessary for the permanent treatment of brittle diabetes. In our next videos, we will talk about the symptoms and causes and also the management and treatment of this condition. Please share with your friends and also subscribe. See you next time.